I looked at specifically for these two conditions. So they do a lot of testing for the spaceflight associated neuro-ocular syndrome with MRIs and eye scans before, and then they compare it to MRIs and eye scans after. They've also installed eye scans on the International Space Station too, to look at it during spaceflight too. And so they do a lot of things to mitigate as best as they can, and to kind of look at the changes, because we're still very early stage of research. But for things like the bone loss and the muscle loss, astronauts have to do about 3 hours of exercise per day of like weighted resistance, resistance training, because the weight obviously doesn't matter, but using like strong resistance bands that pull them down to the side of the space shuttle, so that they can still like use a treadmill and preserve that muscle and bone mass.
I also think we're learning more and more now that like having a healthy amount of skeletal muscle in your frame, it acts as like a bulwark against a lot of chronic diseases, and from cancer to diabetes, and with the amount of radiation that you're going to get exposed to up there, like incidence of cancer, like risk for them probably shoots up like 100-fold compared to like the regular person. I might be butchering the numbers, but still, you get the point. I just imagine if I was a doctor for an astronaut, I'd be like watching like a hawk.
Right.
Like you'd be saying like, no, you're coming into the office like every week if I had my way, kind of thing, and you're not allowed to go out and party and drink alcohol at all. Which would be kind of miserable, I guess, for the astronauts. But I
just want to come back and have a glass of champagne to celebrate.
No.
No.
You just shove like a strawberry smoothie and like, eat it.
There you go. That's what you get. Yeah.
I was going to ask you kind of like, where do you see the research going in the next 10 years? But I think that's like a bit of a broad question. Let me rephrase it. Because we talked about a lot of things that need to be kind of addressed.
Right.
In the next 10 years, what do you think is the issue that's going to be most likely addressed / solved?
Yeah. So I think probably spaceflight associated neuro-ocular syndrome. I think we're going to have a much better understanding of that. We're going to have a lot more astronauts that are in space that we can look at before and after their space flights, and get good pre-flight and post-flight data, which has been a little bit iffy. So until recently, we're gonna have a lot more people up there for a lot longer. We're gonna have people trying to travel to Mars, maybe not in the next 5 or 10 years, but soon.
Definitely not by 2026.
Definitely not by 2026. And I think that condition, we have medications that can reduce the intracranial pressure, reduce the spinal fluid pressure. So I think we have treatments that will be able to help that once we have a better understanding of kind of the pathophysiology and mechanisms behind that.